I know that most of you are not familiar with the Alumni Association, but because of people who have gone before you, people who have graduated ahead of you, they have come back to share their experience with you today at Career Day. Most, if not all, of the people you're going to hear speak today are alums. So they've donated their time, and I hope that when the time comes, you will consider doing the same for Shorecrest. This this Career Day is a little different because we're going to kick off with a very special award, the awarding of our Outstanding Alumni Award. And the speaker has come a great distance to speak with you today, so I hope that you'll give him his undivided attention. Before I begin, I want to thank Kate Merritt and Debbie Schenkman and the Advancement Office for putting this day together. You have no idea how many moving parts and how many schedules have to be coordinated so that we can bring all these speakers here today for you. And so, by a round of applause, I'd like to thank them. The Alumni Distinguished Achievement Award. The intent of the Alumni Distinguished Achievement Award is to recognize individuals who have made significant and meaningful contributions to society. Through their pursuits, whether intellectual, professional, artistic, or social, recipients of this award have a positive reputation and serve as both role models and a source of pride to past, present, and future Shorecrest graduates. Recipients bring high honor to themselves, their community, and the Shorecrest Preparatory School. A committee, including Shorecrest alumni, faculty, and parents of alumni, have chosen Dr. Michael Ison, class of '89, as this year's recipient. And here to tell you a little bit more about Dr. Ison is our headmaster, Mike Murphy.
Good morning to all of you, and welcome to our Career Day. And I want to extend a very special welcome to Dr. Ison's parents who have joined us today. It is really very fitting that Dr. Ison is with us today. If you walk down the alumni walkway, which is between this theater and the library, you will see the photographs of Bob Willis, of Patrick Wilson, and of Carlos Barvis. They were the first three recipients of the Distinguished Alumni Award. The newest photograph is of Dr. Michael Ison. And so he is with us today for Career Day, and his story is magnificent, and I think it tells a story that many of you should take to heart as you are considering your collegiate and your professional careers. Dr. Ison commenced from Shorecrest 27 years ago. He was a member of the class of 1989. Mrs. Newton, Doc Littlefield, Senora Andres, Mr. Hunt, Dean Sessions were all teaching in the upper school at that time. During his senior year, he was the senior editor of this yearbook, a brand new style of yearbooks for the school. I'll say more about it in a moment. He was the editor-in-chief then of Crestviews. He was an officer in SAD. Interestingly enough, when you hear about his career, he was not in the science club, but he was on the staff of Quill and Scroll. He was in Mu Alpha Theta. He was in National Honor Society, and he was a leader in the Thesbians. Dr. Ison left Shorecrest and he attended Grinnell College in Iowa, and he received a bachelor's degree in chemistry and in Chinese studies. He then returned to Florida and he earned his medical degree at the USF College of Medicine. He then went to the western end of the United States and did a fellowship at the Oregon Health Sciences University. He then came back to the East Coast, to the University of Virginia, where he earned a Master's of Science in Health Evaluation Sciences, as well as a fellowship in infectious disease. He's already received his doctorate degree. He's now received a master's degree and a second fellowship, and he decides to continue his education, and he pursued training in transplant infectious disease at Mass General Hospital and at Harvard Medical School. Then, in 2005, 11 years ago, Dr. Ison joined the faculty of the Divisions of Infectious Disease and Organ Transplantation at Northwestern University, the Feinberg School of Medicine. Today, Dr. Ison, and this one's a mouthful, is the medical director of Transplant, an immune-compromised post-infectious disease service at Northwestern University's Comprehensive Transplant Center, and he is an associate professor of medicine and surgery. He is a man who has had an incredible lifelong pursuit in his passion of medicine. He has had an incredible impact on the medical community and on hundreds of patients and physicians. Would you please join me in congratulating and welcoming Dr. Michael Ison for the Distinguished Alumni.
All right, well, thank you very much for that incredible introduction. It's a great honor to be here today. Just to give you a sense of how much Shorecrest has changed. When I was involved in our first Shakespeare production, we did not have a theater like this. We actually performed in the elementary school cafeteria. And then by senior year, when we did Little Shop of Horrors, which was a blast, we performed in a now demolished gym. So we didn't have the kind of facilities that we have, that you all have today, so you're incredibly lucky. It's an incredible honor to be back here today. What I thought I would do is, yeah, there we go. Something else popped up, that's okay. So what I thought I would do is give you a little bit of a story about how I transitioned from sitting in the seats that you were in today. And you can see me hanging from a paraglider where a gift my senior year from one of my best friends, Chevy Ekus, who was working in the summer selling people those funding tickets, to where I am today at Northwestern. And I'm impressed that you were able to pronounce that entire job title. It's quite a tongue twister. And when I started thinking about this talk, I first wanted to reflect on my time here at Shorecrest. And when I look back at that yearbook that you got to see, it made me realize that that theme that we selected, definitely different, was the theme that I started thinking about here at Shorecrest, and really has been what has been responsible for my success ever since. So proving that the core values that you pick up here at Shorecrest are what will carry you through and make you successful as a career. And what I want to show you is how thinking differently and approaching life in a slightly different approach is sometimes very, very successful. As you heard, this was the first time that a yearbook was designed on a computer with this kind of glossy cover. No one had ever done it before. And there was a lot of concern that this wouldn't be well received by the student body. Well, in addition to people loving the yearbook, we received 3 awards, the first time that the Shorecrest yearbook had received an award, by thinking differently and doing a different approach, and in updating the content to be timely and thoughtful. Then it was time for me to think about college. And again, I said, let's do things a little bit differently. Most people would say, I'm from Florida, let's stay in a nice warm place, let's go to a school people have even heard of before. But I decided to go to a school called Grinnell College in Grinnell, Iowa. And I'd be interested to see if anyone even heard of that school. All right, that's a good sign. Well, Grinnell College is a very small school. When I went there were 1,200 students. Again, it was kind of intimidating because, as you know, coming from a school like Shorecrest, my graduating class had 56 individuals in it. And I remember sitting down in the freshman orientation, and there were 300 students. That was almost scary to me to think of so many people, when in fact, many of my classmates had gone to places like University of Florida, University of Miami, that had huge numbers of students in the class. I was afraid that I would get lost. So I chose this wonderful little school in the middle of Iowa. That school really was a changing point in my life. It's where I learned to think very much, again, outside the box, to think and challenge what I was told, to learn to refine my writing, And more importantly, ask the tough questions. Don't just say, this is the answer. The question is, why is that answer? How do we know that the answer that the professor is telling me is that, in fact, truth? And that was a theme that has continued throughout the remainder of my career. Beyond that, then I came back to Florida. I was glad to escape the icy cold, where I went to medical school. And I was very thankful at my graduation to have my father, who's pictured here with me, give me my diploma. I also met John Sinnott, who's in the middle, who basically introduced me to the field of infectious diseases. At the time that I started medical school, I only wanted to do one thing. I wanted to do transplant surgery. I had no interest at all in infectious diseases. Unfortunately, the surgeon that ran the transplant program over at USF basically told me he didn't have enough time because he had just accepted 2 fellows from Japan. But that he would set me up with Sally Houston, another physician, who was the head of their transplant infectious disease program. I was crestfallen. This was terrible. Who would ever be interested in infectious disease? No one does infectious disease. It wasn't a sexy field. It wasn't something that everyone aspired to. I was really disappointed. But literally on day 1, meeting John Sinnott, I became energized with a passion in the field of infectious diseases. He showed me that there was so much to be learned. And it was from that moment forward that I decided to pursue a career in infectious diseases. I then went out to the city that I think is the most amazing city in the world, Portland, Oregon, where I did my internal medicine residency, and you can see my intern class pictured there. I then decided to go and take, again, a very non-traditional approach. I wanted, at this point, to do transplant infectious diseases. And my mentor in Oregon said, you should go to the University of Virginia. This was considered by many to be one of the best schools teaching infectious disease. The person who literally writes the textbook on infectious disease was the person in charge of the division. So you couldn't have picked a better place. Except for my situation, they had no transplant infectious disease. There was no one there that really could mentor me in doing what I wanted to do. But I listened to my mentor because he clearly must know something why I should go there, and absolutely fell in love with the program and decided, okay, I'm not going to learn everything that I need to know about transplant infectious diseases, but at least I'll get a solid training in the field. And so then I sat down and talked with mentors, and again, sat down with Fred Hayden, who became my mentor, and he described the opportunities that he had for me. He talked about influenza. Who cares about this virus that just barely makes people sick, I thought, when I first sat down with him. But when I listened more to what he had to say, not only did he listen to what my interests were and created a research program that had a clear focus on infections in transplant patients, but really was interested in making sure that my career was launched and that I did the things that I wanted to do. And I followed my heart and basically said, this is not what I thought I was going to be doing, but this is what I would be working on. And this was the beginning of a career in which we have been successful at developing 2 novel drugs for the treatment of influenza that are now licensed by the FDA. I've been able to work with the World Health Organization to establish a career in which we are able to better advocate for the special and unique circumstances of treating and preventing infections in this population. But again, because I really wanted to do transplant infectious diseases, I decided to go to Mass General in Boston, which had the first transplant infectious disease program in the United States. And that really launched my career. But then I started reflecting, so what kind of things have I done with this career that demonstrate thinking outside the box to really help you think about taking an approach that may be not the traditional approach? And so I wanted to talk through a couple of things that I found very exciting in the process. Most of these are related to working on what they call donor-derived infections, or infections that are present in an organ donor that at the time we don't recognize, but that cause an infection or disease in the recipient of that organ. And this all started my first month in Boston, when we had a 54-year-old gentleman who had hepatitis B, hepatitis C, and liver cancer. Without a liver transplant, he would be dead within 3 months. He was very lucky and was brought in for a liver transplant, and initially did very, very well. But on the 5th day of his hospitalization after the transplant, he developed a fever and a headache. He had received the standard treatments that we had given him prior to the transplant itself. And when I examined him, I really didn't find anything out of the ordinary. Unfortunately, he continued to do worse. His liver enzymes became more and more abnormal. He had a seizure, which they thought was because his oxygen level may have been a little bit low. And he got sicker and sicker. And we couldn't figure out what was going on. We ran every test we could to figure out what was going on with this patient. And then we got a call from another infectious disease doctor at another hospital asking how our patient was doing. And it turned out that she was caring for the 2 kidney recipients that came where the kidney came from the same donor. And they were having the exact same clinical presentation as our patient has. And the lung recipient, who was managed at a 3rd hospital, had died the day before, again with a very similar picture. Well, that's when we knew we needed to get real help and reached out for the Centers for Disease Control. And basically what they found is this adorable little hamster was the cause of all of these patients' very sick condition. What had ended up happening is the donor had purchased this hamster for her son. This hamster had a virus called leukochoriomeningitis virus, which if you or I were to get infected with this would just cause a very minor headache. We may not even pay attention to the fact that we had that infection. But as we learned, when this is transmitted with the transplant organ, it can make the recipients incredibly sick. Well, this was a very sad situation for our patient, but what it made me think is, well, how do we learn from this? And when we went to write up the paper to document that this had occurred, it turned out this was not the first time that this virus had caused this clinical symptom, but in fact it was the second time, yet no one in the field of transplantation knew anything about it. And because of this, I realized the biggest gap and the biggest hurdle for us wasn't that we couldn't take care of this patient, was that we didn't have a system to recognize these kind of problems, to identify how to prioritize, how to do testing and to prevent disease transmission. So we established the infrastructure and system in the United States called the Disease Transmission Advisory Committee that is an organ vigilance system. So basically this requires that any organ transplant center in the United States that recognizes an unusual occurrence in their patient has to report this to the National Authority of Organ Transplantation. This data is collected, and over the past decade, we have gotten reports on over 2,000 reported events. About 10% of these are true transmissions from the donor to the recipient. And with this, we have started to improve our outcomes in transplantation. We have new tests that help reduce the transmission of these diseases. And more importantly, we became the global standard. And I was very lucky to be asked by the World Health Organization to have what they call a secondment, where they basically take me on to promote what we did in the United States to all corners of the world. And with this, we did the Alfredos project, which was funded by the European Union to come up with a framework for the Europeans to develop a system and the policies and rules to require this level of reporting in the European Union. And this policy was enacted by the European Parliament 3 years ago and implemented a year ago. We then worked very closely with the Italian government to establish their donor infection reporting network, the first network in Europe that mirrors what we established in the United States. I was then asked to go to Australia and do a very similar project with them to first start by establishing the SEALS network, which is a laboratory infrastructure to help them test donors to help prevent disease transmission. And we have now been working with their version of the Food and Drug Administration to establish a similar organ vigilance system. And more recently, we've worked within the World Health Organization to develop and implement what's called Project Notify, which is collecting all of this information that is being collected by these individual working groups at different countries around the world, and pooling it into one central repository that's accessible through the internet. So again, what we've taken is this very unfortunate event in one of our patients and leveraged it in a way to think not just how we could help that patient, but how we could help patients worldwide. The second scenario that I wanted to talk with you about is another unfortunate event for one of our patients that translated into a huge advancement for our field. We at Northwestern conducted our first lung transplant about a year ago in July. And this patient was the most wonderful person that I've ever met, really a sweetheart, who underwent a lung transplant because of sarcoidosis, an infection that causes the lungs to slowly fail over decades. He initially did very, very well from the transplant, but again, had a very negative turn of events. At about day 10 after his transplant, he stopped thinking very clearly, and when we started evaluating him, we found that his ammonia level, the waste product as our body breaks down proteins, had built up to levels that were very, very high. We did every test we could imagine and couldn't find a reason for this. But in scouring the literature, we wanted to do everything for this patient to keep him alive. We found that there was one case report of a bacteria called mycoplasma that the authors felt was the cause of this hyperammonemia syndrome, as they termed it. So we tested our patient and actually found that he didn't have the mycoplasma, but a related bacteria called ureaplasma. And this bacteria, interestingly, cleaves the ammonia free from proteins as its energy source. So at least it had a biologic plausibility. We then gave the patient an antibiotic that treats this bacteria, and lo and behold, as you can see in this graph, his ammonia came down beautifully. He woke back up and was doing great. This was incredible because this hyperammonemia syndrome was previously a nearly universally fatal condition in lung transplant patients. Unfortunately, the patient, although initially improved, had recurrence of his ammonia level. And when we again tried to treat this ureaplasma, which we again detected in his blood, he did not respond to the antibiotic that we gave him. And when we later did sequencing of this bacteria, we found that it had developed antibiotic resistance to the antibiotics that we had used. Unfortunately, he passed away from this condition, like many of the individuals that had this condition previously. But because we were not happy with this unfortunate event, we continued to do more. And we went back and we collected specimens from a number of patients that went on to die from this infection, and found that every single one of them had this bacterial infection. And subsequent to the initial report that came out in Science Translational Medicine, we found that this appears to be coming from the donor, as we've had 2 instances where we could document that the bacteria was present in the donor, got transmitted to the recipient, and when grew to high enough levels, caused the recipient to be ill. But the important thing about this story is with this discovery, we have transformed this disease from one that was nearly universally fatal. The last 12 cases that we are aware of were successfully treated, and the patients are all alive and thriving today. So again, many people might have given up and just said, this poor patient passed away, isn't this terrible? But again, thinking differently and thinking outside the box, we didn't stop there. We kept asking questions, trying to figure out what was the root cause of this, so that this would never happen to another individual. So hopefully this gives you a flavor of why I think infectious disease is so incredible, why a career in medicine is so incredible, and hopefully I'll have a chance to talk with you a little bit more about these careers. But more importantly, no matter what career you choose, I hope that you think outside the box and do things differently. Don't go to the safe school that you know you'll do well at. Go to someplace that's going to challenge you. When you're challenged with something, don't take the easy path. Take the more challenging path. You'll be far more successful in the long run. So with that, I want to thank everyone for listening to this little presentation. Most importantly, I want to thank Meredith Krause, who's pictured there with the 1980s hair and the big poofy dress, who was my best friend here at Shorecrest and was who nominated me for this award. I want to thank all the faculty and my friends from here at Shorecrest. Really, without the education that I got here at Shorecrest, I would not be the person that I am today. I wouldn't have thought to do things differently. I wouldn't have thought to be a success, which is what we all have the potential to be. I want to thank all of my mentors along the way, Dr. Sinnott, Dr. Strasbaugh, Dr. Hayden, Dr. Fisher. But more importantly, I want to thank my parents, Arnold and Carol, who are here in the audience, who, as we all know, paid the very expensive cost to have us go to Shorecrest. But that is just the beginning. They've been there all along. They've been there supporting me, pushing me to strive, being there to support me when I succeed, and to help me when I don't. So thank you very much, and thank you very much for the support.
As a chair of the committee that chooses the recipient of this award, I think we got the right guy. Thank you, Dr. Ison. If I took anything from that speech, it's that sometimes you feel as though life has given you a setback, but it is really an opportunity. Today is an opportunity. The people that I'm going to release you to go hear now are the kinds of people that people like me pay to hear speak sometimes. You're getting it for free because of the generosity of alums who come back to give back to you. Seize the day, seize this opportunity, ask questions, and try and draw something out of this so that you can use it in the future. With that, I think we're going to release you to go to your sessions. Enjoy the rest of the day, and thank you.